Before we dive into cancer concepts, let's think about the body as a well-organized team. Every cell has a role, follows rules, and works together to keep us healthy. But what happens when some cells stop following the rules? Today we explore this question and how it matters in bodywork. Cancer isn't just one disease, it's a collection of over 100 different conditions. What they all share is uncontrolled cell growth and replication. Treating cancer often requires a combination of approaches tailored to the type and stage of the disease. Massage therapy can play an important supportive role for cancer patients, but it must be done safely. Cancer fundamentals with risks and statistics. As we discussed before, cancer encompasses over 100 diseases. Cancer can start in different tissues, and we classify it based on where it begins. Carcinomas arise from epithelial tissue. These are cells that line organs and surfaces. Sarcomas develop in muscle or connective tissue, which includes bones and cartilage. Hematologic cancers like leukemia and lymphoma originate in blood or lymphatic tissue. To understand cancer, we need to know how normal cells become malignant. This transformation involves genetic mutation that disrupt normal cell regulation. Studying these changes helps us diagnose cancer and develop treatment, but it also shows why cancer is so challenging to treat. Cancer is a major public health concern. In the United States alone, about 1.7 million new cases are diagnosed every year. Both men and women face a high lifetime risk of developing cancer. This prevalence means that nearly every family is touched by cancer in some way. Thankfully, survival rates have improved significantly. The 5-year survival rate is now about 67%, thanks to better screening and treatment. Early detection plays a huge role in improving outcomes. Not all cancers are equally common or deadly. Non-melanoma skin cancer is the most common type. However, lung cancer remains the leading cause of cancer-related deaths. Prevention and research are key to reducing its impact. Public health initiatives focus on lifestyle change, screening, and education. Ongoing research aims to find better treatments and ways to prevent cancer altogether. Biological mechanisms with steps in metastasis and causes of cancer. Cancer starts at the genetic level. Mutations in key genes disrupt normal cell regulation. Oncogenes, which normally promote cell growth, become overactive. Tumor suppressor genes, which act as brakes, lose their function. This imbalance leads to uncontrolled cell replication, the first step toward cancer. Once cancer cells multiply, they don't stay put. Mutated cells invade nearby tissues silently without triggering inflammation. This stealthy spread makes early detection difficult. Tumors need resources to grow, and they find a way. Cancer cells stimulate the formation of new blood cells called angiogenesis. These vessels deliver oxygen and nutrients, helping tumors thrive. Cancer's most dangerous feature is its ability to spread. Cells gain mobility into the bloodstream or lymphatic system and travel to distant organs. This process, called metastasis, leads to secondary tumors and complicates treatment. Cancer can start from within the body due to factors we can't always control. Genetic traits passed down through families can increase susceptibility. When programmed cell death, called apoptosis, is inhibited, damaged cells survive and multiply. Immune dysfunction means the body fails to recognize and destroy abnormal cells. External factors can also play a major role in cancer development. Environmental exposures like cigarette smoke, radiation, and certain chemicals can damage DNA. These carcinogens increase the risk of mutations that lead to cancer. Some infections can set the stage for cancer also. Viruses like HPV and hepatitis Bacteria such as H. pylori and even parasites can cause chronic inflammation. This persistent irritation can lead to genetic changes and cancer. Cancer doesn't necessarily have a single cause. It's the result of multiple interacting factors. Genetics, environment, lifestyle, and infections all combine over time. Because of this complexity and long latency, prevention and treatment must be personalized. Clinical presentation with signs and symptoms. Cancer often starts quietly. Early symptoms can be subtle and painless, making detection challenging. This is why many cancers go unnoticed until they've progressed. Early detection is crucial because treatment is most effective in the initial stages. There are some warning signs we should never ignore. Changes in bowel habits, unexplained bleeding, persistent sores, and enlarged lymph nodes can all signal cancer. These symptoms may seem minor but indicate serious underlying issues. Cancer doesn't just affect one area, it can impact the whole body. Fatigue, weight loss, fever, and night sweats are systemic symptoms. These occur because cancer alters metabolism and immune responses. Remember, screening saves lives. Following screening guidelines based on age and risk factor help catch cancer early. Early diagnosis leads to better outcomes and less aggressive treatment. Diagnosis and treatment with staging and treatment options. To understand cancer progression, we use staging systems, and the most common is TNM. T stands for tumor size, N for lymph node involvement, and M for metastasis. Based on these factors, cancers are classified from stage 0 to stage 4, with higher stages indicating more advanced disease. Staging tells us how far cancer has spread, but grading tells us how aggressive it is. Grading looks at how much cancer cells differ from normal cells. Low-grade tumors resemble normal tissue and tend to grow slowly, while high-grade tumors are very abnormal and aggressive. Not all cancers fit the TNM system. Blood cancers like leukemia don't form solid tumors, so staging relies on blood counts and symptoms instead. This highlights the diversity of cancer and the need for specialized approaches. Accurate staging is critical for patient care. It guides treatment choices, predicts prognosis, and ensures clear communication among healthcare providers. Staging also supports clinical research by standardizing how we classify cancer. Cancer treatment often involves multiple strategies and timing matters. Neoadjuvant therapy is given before the main treatment, usually surgery, to shrink tumors and improve effectiveness. Adjuvant therapy allows the primary treatment to reduce the risk of reoccurrence. Not all cancer care is about curing the disease. Sometimes the goal is comfort. Palliative therapy focuses on relieving symptoms like pain, fatigue, and anxiety. It improves quality of life for patients at any stage of cancer. And cancer treatment isn't one-size-fits-all. Primary options include surgery, chemotherapy, radiation, targeted therapy, photodynamic therapy, and stem cell transplantation. Each method works differently and is chosen based on cancer type, stage, and patient health. And cancer care requires teamwork. An integrated approach brings together surgeons, oncologists, nurses, and supportive care specialists. This ensures treatment is tailored to the patient's need and cancer specifics. Prevention and supportive care with prevention strategies. One of the most powerful tools against cancer is prevention, and it starts with lifestyle. Avoiding tobacco and limiting alcohol significantly lowers cancer risk. Maintaining a healthy weight and engaging in regular physical activity helps regulate hormones and reduce inflammation. Beyond lifestyle, certain behaviors can protect us from cancer-causing agents. Using sunscreen prevents skin damage that can lead to skin cancer. Practicing safe sex and getting vaccinated against HPV and hepatitis B reduces infection-related cancer risks. Even with prevention, early detection saves lives. Knowing your family history helps identify higher risk. Regular screenings catch cancer early when treatment is most effective. Public health campaigns raise awareness and encourage proactive health behaviors. Massage therapy in oncology with massage therapy risks and benefits. When working with cancer patients, the disease itself creates unique risks. Tumor sites may be sensitive or painful. Fragile bones, especially in cases of metastasis to bone, increase the risk of fractures. Vital organ involvement means pressure or manipulation could cause harm. Cancer treatments add another layer of complexity. Surgical sites and implanted medical devices require careful handling. Edema, radiation burns, and chemotherapy side effects like neuropathy must be considered. These factors influence where and how massage can safely be applied. Specialized training is essential for safe practice. Therapists need to identify contraindications and adapt techniques. Advanced training ensures patient safety and maximizes therapeutic benefits. Massage therapy offers tangible physical benefits for cancer patients. It helps relieve pain and muscle tension, improves range of motion, which is often limited after surgery or treatment. It can reduce axillary web syndrome, a painful condition affecting the arm after lymph node removal. Cancer affects more than the body. It impacts mental health too. Massage therapy reduces anxiety and depression, and it provides emotional support and promotes a sense of well-being during treatment. Massage can also address specific complications of cancer treatment. Specialized techniques help manage lymphedema, a common side effect of lymph node removal. These approaches improve comfort and reduce swelling. Ultimately, massage therapy enhances overall quality of life. It improves sleep, appetite, and mood. These benefits support holistic cancer care, complementing medical treatment. Research and future directions. Massage therapy offers significant therapeutic benefits for cancer patients. It helps alleviate pain, fatigue, anxiety, and depression, all common challenges during cancer treatment. These benefits make massage an important supportive care option. Massage doesn't just help patients, it also benefits caregivers. Research shows positive effects on psychological well-being for both patients and caregivers. This emotional support can reduce stress and improve overall coping during treatment. Massage therapy is increasingly being integrated into oncology care. Ongoing studies focus on refining techniques and safety protocols. Expanding access in clinical settings ensures more patients can benefit from this supportive therapy.